Hello, everyone. Good evening. This is Dr. Thomas Correa, for those of you who do not know me. I'm the director of Echoling Institute, and I have been in the addiction therapy field for last 20 to 25 years. So people who have actually undergone some sort of addiction, directly or indirectly, they know how social stigma has played its role in their lives. Some of them responded to this trauma of social rejection by staying away from the mainstream society or social gatherings, or even from family get-togethers. Some delayed seeking any professional help to get out of their addiction. Some refused to take even any treatment. And this has definitely affected their recovery process also. Some have become very rebellious and violent while facing social stigma. And we hear about several stories of violence and crimes attached to addiction. Perhaps this is also a response to social stigma. Today, as we observe the International Day Against Drug Abuse and Illicit Trafficking, United Nations presents this unique theme on people first, stop stigma and discrimination, and strengthen prevention. We have gathered here from around the globe to discuss about this theme today on what do we mean by people first. We have an eminent panel of experts to speak on various aspects of this theme, and a well-known moderator who is known to most of us is going to really lead the show. We welcome Dr. Thirumagal, the moderator of the panel discussion, who has been an addiction therapist for more than 3 decades, a global trainer of international reputation, a curriculum developer for UNODC and Colombo Plan, and above all, the advisor, consultant, and main trainer for Echoling Institute. People who have undergone training under her knows what she is. Some of you who would be joining our second batch of students on Science of Addiction on 30th June will never forget your experience of being trained under Dr. Thiru. Today, as we actually get into this panel discussion, I take this opportunity to welcome all of the panel members and participants to this particular program. We have students undergoing our course on addiction science attending this program. We have our alumni from various parts of the world who have already undergone the full course of addiction with us. We have the batch 9, which is already undergoing. They are with us. And some of our trainers are also here. So a very hearty welcome to each and every one of you from the bottom of my heart. Now over to Dr. Thirumagal to take on with the program. Thank you.
Thank you, Dr. Thomas. Thank you all for being here. I know 1 hour is a good amount of time to spend in the evening, but the UNODC's theme on addressing stigma is, we've been building up to it. Over the past 2-3 years, the need to address stigma has been very powerfully felt. Where people in the field, people in recovery, families of people with substance use disorders have repeatedly recognized how stigma can interfere with, can hamper treatment entry, can interfere with the whole treatment process, and also be a barrier to recovery after treatment is complete or even without treatment. Oxford Dictionary will tell you that stigma refers to a mark of disgrace. WHO tells us that substance use disorders are one of the most highly stigmatized issues in the world. And this is clearly is really misplaced, because we know their drug use is not a choice. The first time he took it might have been a choice, but developing addiction is definitely not the individual's decision. It's influenced by the environment, in the sense that all of us have played a part in allowing addiction to develop. So that being said, I think today's focus is on what we can do to reduce stigma in our communities. and recognize that language matters, because the words that we speak, we write, we hear, etc., influence our attitudes. It changes our cognition, the way we look at things. It shapes our attitudes. And when it shapes our attitude, it also influences the behavior that we demonstrate towards people struggling with substance use disorders and also their families. So that being said, I think it's time to hear from our speakers. Dr. Thomas has done a great job by giving us 5 speakers from different backgrounds. Each person is very different from the other, like chalk to cheese sometimes. But all of them are people with a professional understanding of the disease of addiction. They've come with a lot of experience in the field. And more than anything more, they're human beings who really care, who are able to look at the struggle that comes with addiction and have it in them to play a very supportive role in their recovery. I cannot think of a better collection than that. It's a great honor to be here with all of you. I would introduce each one of them in turn as they speak. Otherwise, I will be giving a whole lot of information and it will wash all over you. So I think we will start with Mr. Ashwin Thind from Malaysia, a clinical psychologist by training. And as a person, I know him to be a very stable guy with a very clear head, very clear head. He approaches issues without letting his emotions or biases or prejudices come in the way. What's special about him is chosen to work with a lot of vulnerable groups, like people in prisons, people with the criminal justice system, if you prefer that word, people with from the LGBTQ background. He's worked with refugees. He's chosen to work in with therapeutic communities in Malaysia. He also works with a private treatment center like Solace. He's also a trainer, conducts training related to UTC on behalf of Colombo Plan and UNODC. He has his ICAP certification. So welcome, Ashwin. I call upon you to get the show going.
Hi, thank you, Dr. Thiru. Yeah, it's good to see you again. You're looking very pretty in your sari today.
Thank you.
Good evening, everyone. You know, when you were saying earlier, I was reflecting before preparing for this, and I thought that as I was going through the UNODC brief for the team this year, precisely like what you said, I think it's been a build-up over the last few years, and I think it's great that we are, looking at more stigma, we are looking at more inclusive approaches, we are looking at more non-judgmental sort of approaches. I remember initially we had the Support Don't Punish movement, which was an alternative to the UNODC Day Against Illicit Substances. But I'm really happy to see this now that it seems that we are merging. And I think this is really important as it reflects where we need to go in terms of substance use disorders, decriminalization, stigmatization of substance use. So I'm really happy to sort of see that. So today I thought that, I'll speak about 3 things. We always think that maybe stigma is more among people who are not in the field. So I thought maybe we'll look at stigma among addiction professionals. I also thought, I think you've already taken all the points I wanted to speak about, the language we use and the mind, how that influences the mindset. But I will add on a little bit to what you said on that. And I think thirdly, also, I would like to speak on structural stigma and discrimination about punitive drug policies. So I think with stigma among health professionals, usually the thing is that what we don't realize is that the stigma unknowingly is absorbed and we sort of internalize it. And this is usually the result of years of unconscious indoctrination of attitudes and beliefs that we've been exposed to. And also among addiction professionals, there exists a lot of stigma. And I suppose one reason why that occurs is like what you said, of all the mental health fields, addiction is the one that has got the most amount of stigma. And just because someone may be trained or credentialed, that doesn't mean that we do not carry that stigma with us. For example, there are various approaches to treatment and services and how we would sort of address and treat addiction. So one example I can think of is how we approach substances that have got a physical dependence. For instance, like heroin, we know that drugs like heroin actually cause severe physical dependence over an extended period of time. So there are medication-assisted therapies for this, like Suboxone and methadone, but you also get centers, you also get professionals who are, until today, despite the evidence, totally against methadone. So then the people who come for treatment are left with a few ultimatums. One, you either withdraw cold turkey, or two, you don't even enter my treatment center. And the problem is sometimes don't even refer them because the attitudes and beliefs are so strong against things like medication-assisted therapy. And this isn't helpful. And I think secondly, also sometimes it's important to sort of remember that a lot of the people who work in the addiction field may also be in recovery themselves, right? And what happens is that this can be a double-edged sword, because that can actually paint and maybe even taint our perception of what is substance use disorders, what is addiction, how do you treat addiction? And sometimes there is a certain bias towards what recovery is. So for instance, there might be a very strong inclination towards only 12-step recovery being the traditional recovery, and this being the only approach. And this might be a challenge because, of course, it's impacted the person with lived experience. It's worked for them. And we want now the best for other people. To see, the thing about stigma, like you said, is that it influences our beliefs. And so I believe this works for me, therefore it might work for someone else. And like what you were saying earlier, the importance of language. One of the theories that I work from is REBT, and Albert Ellis was very influenced by the theory of general semantics that says the language we use, like what you said earlier, sort of the language we use influences our perceptions, our attitudes, and our beliefs. Now, a lot of the time we speak in abstractions and generalizations. So we might use words like, oh, he is a junkie, or he is a drug addict. Firstly, therein already lies the fact that these words and these terms are already associated with negative feelings. Secondly, when we use general abstractions, like for instance, oh, he is a drug addict, excuse me, or he is a junkie, what we are saying is that everything about this person is a drug addict. We discount everything about him. It makes it easier for me to cause a divide, create a distance. So you dehumanize the person. And I think this is why when we talk about stigmatization, we are looking at when we talk about destigmatization, we are talking about using words like, or terms like, a person who uses drugs. It might be a bit long, but it is worth it. Because we know that by doing this, we acknowledge there are a lot of other factors to this person. He could be a father, a mother, a brother, a sister, right? And thirdly, when we're looking at structural stigma and discrimination, we're looking at, this is the impact of years and years and years of punitive approaches. We are looking at the war on drugs, and how this has influenced sort of unfair laws and policies and practices on a societal level. And as a result, we incarcerate and criminalize people who have substance use disorders. And like you said earlier, just another 1 minute. Like you said earlier, I had to put a timer because I knew I probably overshoot.
That's okay. Go ahead. You're doing well.
And like you said, we know addiction is a disease. Not only is it a disease, the other aspect is also a learned behavior, which means it is treatable. We can start imparting different skills. There are many influences that we can change. So when we put people in prisons, we are not helping them. We are actually robbing them of their recovery capital. We are robbing them of actually being a human and saying, this is indeed your choice. You are a bad person. This is a willful vice, and you deserve to be punished. That doesn't help. How does that help? For like in countries like Malaysia, if you have a criminal record, you cannot work. There'll be background checks. You're totally very, very difficult to find jobs. And without jobs, how are we going to actually sustain our recovery, engage into meaningful life, meaningful living? So I think that these are things that we also need to address moving forward, when we're working in the field of addiction. And I'm happy to say that in Malaysia, we are moving towards more person-centered drug policies and approaches. However, that said, we are also taking one step back when it comes to tobacco policies. We're actually going to we are possibly going to pass a bill on something that's called the Generation Endgame, where anyone born after 2007 is banned from buying tobacco. So on one hand, we're actually making progress, but I think on the other hand, prohibition for tobacco is, we're sort of coming back to square one. So these are some of the things I thought that, we highlight today, and that's important to sort of talk about when we are looking at stigmatization and discrimination in the substance use disorder field. All right.
So trust Ashwin to put a gun to our heads as he starts. Inviting addiction professionals to look at themselves before we preach to the choir. Yes, I like the fact that you highlighted languages like putting the person first instead of saying the person with substance use disorder rather than a person with rather than addict, etc. I also noticed in your speech that you used the word person with lived experience. Even in people in recovery, we used to refer to them as recovering users or recovered users or ex-drug user. And right now we are recognizing they've lived through the experience and there's something very valuable they have. So the person with lived experience is a far more respectful term. Yes, thank you for highlighting that and also for talking about the fact we need that incarceration or imprisonment really make sure they almost don't recover. That's another nail in their coffin. Thank you for that, Ashwin.
Thanks, Dr. Thiru.
Next, we have Grant. Whenever Mr. Grant Sanders, he's from Hong Kong. He's been running an organization that helps intermediate people, provides outpatient services, refers them for help if they need residential services, provides supportive services. His group was called as Recovery 852, and he's been trying to work with people struggling with drug use disorders there. And if Ashwin can talk straight, Grant is a little more dangerous. He will tell you exactly what he thinks, and he does not believe in mincing matters at all. So, Grant, I'm looking forward to hearing from you about this. Grant also has experience in the correctional field setting, and he's worked with recovery user from people in recovery for various backgrounds. So I'd love to hear what you're saying, Grant.
Thank you for your kind words, Dr. Thiru, ma'am. That color really suits you. And I just wanted to thank Dr. Thomas for inviting me to this panel. It's a great honor to be here. I've got about 5 minutes, so I'm going to keep it brief. My topic, what I'll be talking about this evening, is self-stigma in recovery. And this is something that it's a big subject. There are so many areas, but for time's sake, I guess I'll just focus in on three areas related to self-stigma. So self-stigma essentially, for me, is an internalization of negative stereotypes. Excuse me. So it's very subjective. It's very inward. It's subjective. So the three areas that I would look at is education. From my experience, just from working with people here in Hong Kong and abroad, but mostly here. So mental health is another, and age. So there are three areas where I've noticed self-stigma taking its toll on people. So for education, Hong Kong is a very prosperous place. There's a lot of very well-educated people, but there are others that fall through the gap. So feeling shame and guilt for wasted years, while in active addiction, feeling inferior and inadequate, constant comparing with fellows, toxic inner dialogue, not able to stop that, not able to re-enter the workforce, so to speak. For some people, they've gone to prison for a small amount of drugs. In Hong Kong, the sentencing is very conservative. I agree with Ashwin. people, I know someone that might go to prison now just for a very small amount of marijuana. He's got a wife and kids. He's a home decorator. He will lose his livelihood and most likely his job. So it's people like him, where, they lose touch with themselves, and that self-stigma just keeps, it's a vicious cycle. So, it's a skill sets. So there's a lot of stigma around education, mental health, feelings of shame, for sure, discrimination, feelings of isolation, judgment, being judged. Again, self-stigma really is an internalization of society's negative stereotypes, psycho and, schizo, and there's all these words that people use to describe people with co-occurring mental disorders. This does not help. And, I'd like to touch on what Ashwin was saying. There are multiple pathways to recovery. But maybe we can, I don't want to deflect, we can come back to that. But there's that fear of not being accepted. That is that self stigma, when it comes to people in recovery, and age, feeling discriminated against. Another client that I know was a senior executive in Hong Kong, and his cocaine addiction and his sex addiction, basically, he lost everything. And now he's coming out of treatment for the third time, and he's trying to reinvent himself. He's trying to, and he's struggling. He's in his mid to late 50s, and his skill set is not up to date. So again, there's wasted money, there's wasted time. I'm just checking my time here. So, again, negative self-talk. But, self-stigma doesn't have to be about negative beliefs and attitudes, so to speak. There is hope. Challenging negative thoughts by identifying self-stigmatizing thoughts, questioning their validity. So stopping and just, looking at what is actually going on now. So that's my time. I got a minute left. So I want to be respectful to the group, and I don't want to go over time, but connecting with supportive people, whether that's a recovery support group, or whether that's a therapist getting help, or a community. That's, positive self-talk is also extremely important. The promotion of personal development, celebrating strengths and achievements. For me, my personal addiction on a personal level cost me a lot. And I didn't finish school, and I was modeling, and I was in the film business. This was many years ago when I had hair. And I got here to Hong Kong. I didn't have a degree, and I struggled. But what I did is I went to university, I applied, I went through all that hard work, I did the entry exam, I passed that, and I got my bachelor's. So there is hope, and there is a way forward. That self-talk doesn't have to be toxic. I'm very passionate about helping people. It is something that is very dear to my heart. So I'll end it there. Let's celebrate strengths and achievements, and help motivate our clients to become better, to self-improvement. There is hope. So that's my 10 cents. So thank you, Dr. Tiriman.
I think we would like to hear some more from you about what therapists can do, what counselors can do in the addiction centers to address this internalized stigma, to address the self-stigma. You were talking about affirmation, celebrating their success, etc. But I think it will be helpful for us to get some clear guidelines on what exactly we can do, some do's and don'ts, what we can follow in the treatment centers. I think, Ashwin, we would also like to hear a few thoughts from you on that aspect, in the sense what all of us can do and should not do in the centers. I'd like you to collect your thoughts, and let's move on to hear from Vikas Sharma. Vikas seems very silent today, which is not his usual style. He's a very friendly, very amenable and very cheerful person to work with. Vikas is from Jammu and Kashmir, one of the most troubled states in India, where addiction is a big issue. Statistics tell us about 88% of the population has problem with drug use, talking about 1.4 million people struggling with that. He runs, and Vikas is right in the heat of it all. He runs a 32-bed center, has been running it for 8 years. He also has his ICAP certification, has his years of experience in working with people with substance use disorders. We would like to hear from you next, Vikas.
Thank you, ma'am. Thank you for, thank you, in fact, Dr. Thomas and Ecolink for, putting me here and so that I can share about myself. And the topic that I've been given is the stigma that I've faced in my recovery. So my name is Vikas and I'm a grateful recovering addict.
Hi, Vikas.
Along with an addiction professional that I am as of today. So when Thiru ma'am was doing the introduction part, I had asked her not to mention my years of recovery. So today, I wanted to do that myself. There was a reason behind that. So I am into my 20th year of my recovery. August, I will complete 20 years of my recovery. So when I say that it's been 20 years of my recovery, or I'm into my 20th year of my recovery, along with that, I have faced stigma for 20 long years in one form or the other. I'd like to mention here that my initial recovery years were more difficult because I wasn't equipped to handle stigma. As I gradually grew in my recovery, I was able to handle it better. Earlier I was tolerant, but now I'm patient about it. But I still face it. I faced it in in various forms, be it sarcasm, be it labeling of names being given to me. There were trust issues. There are still trust issues. Still I was many a times looked down upon. I many a times have felt that I wasn't given the due that I had earned in my recovery. So all these things put together, I felt very sad about myself most of the times, and many a times I've questioned myself that why did I reach recovery, or what's the point of being in recovery now? But along with this, I felt more lost in my recovery. Initial years of my recovery, I felt more lost than I used to be in my using days. Using days, there was some purpose that I had. In recovery, for initial 4-5 years, I have questioned myself a lot many times. There used to be a serious self-talk that used to happen, that what's the purpose, or why I am here, or why I had to stop and get into another platform of recovery. So, but the important thing is, as Grant was speaking about, putting myself also into a self-stigma, was that entire things my family was talking about. Basically, I felt more stigma within my family than from the society. Yes, society has also played its part, but majorly what happened, the stigma that came was through my family. Many a times what happened is, what my family used to tell me, it always resonated with what I was going through in my own mind also, because I also didn't feel so good about myself, which kind of, I was also labeling myself. I also did not trust myself with a lot of things. I did not trust myself with money. I did not trust myself with my anger. I did not trust with myself about going out and coming back clean, for that matter. So all this was happening, and my family and society, they were not empathetic. Something that I was looking for within my own self. I thought that there's some growth that is happening on a daily basis, but that was not being acknowledged. And and my family's thought was always on the contrary. I'm thinking within my own self that yes, I've been clean. I'm pushing a day after day that I'm not using, and I am not very sure whether it was my family's expectations about me, but I was doing a tremendous job of not using. It was something which I had not experienced. I was not tuned to do so, but I was not using. And for me, it was a tremendous thing that I was doing. I was not being acknowledged. On top of it, there was so much of pressure. I have been countlessly called upon as a useless, incompetent, and an incapable member of my family. I'm so very grateful. I don't know from where that tolerance came and how I have umpteen number of examples that I can quote and give and share with you, but lack of time. So what happened with me in my recovery? But as before coming to this UTC and getting into this credentials, I was a staunch believer of 12-step program. I thought that is something which has given me recovery, and this is something which can help recover suffering addicts also. But I'm so very grateful I've reached this program, and for me the whole world opened up of more avenues and more thought processes and more things that I can do, or more things that are being done in the world. Otherwise I I was so close-minded when I not joined this this program. And what else I can share is I have had many near-death experiences. Today I'm not afraid of leaving this planet, but I am more concerned about how to make this life useful that I have for myself, obviously for myself and for others, that I can make an impact on, or leave an impact in the society. As I just shared that I'm a staunch believer of 12-step program because that's helped me. So the stigma that I've faced in my life, I recovered from there because I went through the process of doing my steps with my sponsor. And the moment I hit the steps where it talks about amends, that's where my guilt and shame went away. I'm still in the process of doing my amends. But the moment that burden of guilt and shame got lifted is somewhere that I started loving myself, that I am a human being and I need to treat myself as a human being, and I have certain rights as a member of a society, as a member of my family. I could express those to my family, and from there it's a journey, because the moment I started expressing myself within my family that these are my needs and wants, they started respecting that. But gradually they also saw me recovering on a daily basis. Year by year they saw that I am in a recovery process. I don't use anymore. My attitudes and behavior are changing, so they started trusting me. But it wasn't a process of osmosis. It happened gradually, but I went through that grind. I'm so very grateful that my God of my understanding gave me that perseverance, that it gave me that patience, it gave me that tolerance, that I could go through that process. Otherwise, all would have been lost. I wouldn't have been sitting here amongst you people. That probably 15 years back, I wouldn't have, I would have felt shameful sitting here. It took me 10 years to reconnect with my buddies. Because of guilt and shame, I thought they have done it in their life. I am the lost child, so I can't be with them. So it took me 10 years, and one fine day I decided, I went and I sat in their trust meeting, and I could speak, on that level. And although I'm a college dropout, I was a college dropout at that time, I eventually found my degree in my recovery. But much before that, I had fallen in love with my own self by the time I hit my 10 years of my recovery. So from there, it's been a journey, lovely connecting with you people. And, stigma is something which I don't know. I seriously believe that somehow I survived it. I don't know how many people do, survive the stigma. I have no idea. Thank you for allowing me to share with you people. Thanks.
Thank you, Vikas. Talking about personal recovery. Thank you, Grantu. Talking about your personal recovery in a public forum is an act of courage and vulnerability, and we thank you for doing that. What you said was very personally and professionally disturbing to me, Vikas, in the sense that we all make it so difficult for people in recovery. It took you 10 years to come to the point of letting the past go and being good to yourself. It means when you hear your story and hear your comments, I'm thinking, how is it people are actually recovering? We know 50 to 60% of our clients recover. With so much of loaded against them, recovery seems to be a miracle in many ways, because we make it so difficult for people with this disease. Thank you for that. I think this session is going to be a point of self-reflection, where all of us need to ask what we can do to support this process of recovery. Thank you for that, Vikas. I would like your audience to post comments, questions if you want on the chat. Ronnie will put it together so that when the Q&A starts, we'll be able to have some questions for discussion. We are 3 speakers in. We have 2 more people to go. Is there any comment one of the speakers would like to make about it, or something that's top on your head? Anything you want to comment upon? Not at all?
What you're saying earlier, Dr. Thiru, about what we can actually do as treatment professionals and in treatment centers, I think that it's important to sort of, when we look at how we work in MI, it's not only about technique, it's also about embracing the spirit. And I think it's important, like what you say, that for us, we need to actually be able to embrace the whole spirit of what recovery is. And remember that sometimes you're not only doing it, it's not about me, it's actually about the people I'm working with. And then it's very important. I mean, I listened to Grant, I listened to Vikas, and you're right, it's kind of, it's kind of saddening to some extent that it takes such a long time and it's such a Herculean effort. And what do? Sometimes we don't recognize our biases. We talk a lot about trauma-informed, but what do we actually do sometimes to perpetuate that shame? If you come into treatment and I say that this is what treatment is, it has to be this way, then indirectly the message you're imparting to the person is that you are wrong, you are not important. You've been wrong your whole life, struggling with the addiction, and you still don't know what is good for you. Let me be the one.
know best.
And I know best. And that is why I think it is our spirit that is really important, that we need to solve. We need to acknowledge that, like you were saying earlier, putting the gun to the head. I mean, sometimes it's the pot calling the kettle black. I am guilty of stigmatization. I am guilty of this. And I think it's important. That is why to have, a good team, a good supervision, good friends, to be aware of yourself, catching yourself saying these things. I have these discussions with my colleague and friend, and we talk about how things like empathy, all the Rogerian principles, they are skills that are required to be practiced. And he was telling me about how he does training with EFT, and how much empathy training in itself is in itself amazing. I'm kind of surprised to know there's so much to it. But if I think about it, it makes a lot of sense. You need to practice these things because our biases will always be there. Yes. And so I think that being awareness, our spirit, our ethos into recovery and treatment, that's what we actually need to look at as well.
Yes, I agree with the guilt that I also have. When Vikas was talking, I'm thinking, oh God, what did I do? How many things did I miss? I wish I had celebrated recovery more. So I think this session is all about us, about people in the field. Thank you for that, Ashwin. Would anybody else like to make a comment? Anybody else?
These are all thoughtful insights we had and during discussions with the speakers. So we need to take a moment to appreciate everyone who is recovering. And as you already told, as all the speakers have already told, we need to, destigmatize and the way we approach a client. So we need to have an international platform like this to deliver the message throughout the world. Such platforms are really necessary. We need to do more discussions like this in the near future.
Yeah. So Dr. Shiva Anup has spoken up. So let me finish his introduction. Dr. Shiva Anup is a psychiatrist with a master's in psychiatry, worked for a few years in one of the big, I think the center had some few hundreds beds And his outpatient
It's
load
100,
is
more than
per day,
600.
saying about 100, 200 people in an outpatient basis. He comes from working with people from all social levels. We know addiction knows no boundary. Education, socioeconomic status, qualities, gender, age, etc. So Dr. Shiva has sort of seen it all. He has a few research papers to his credit. He's ICAP credentialed. And what will stand out with Dr. Shiva is his ability to reach out to people, the humility that goes with it. When you talk about talking with clients, one of the issues in stigma is understand the person first, ask him about him first before you ask him about his substance use. I think I've heard about Dr. Shiva doing that in practice. And that's what makes him a very comfortable person to work with. So I'm very happy that Dr. Shiva is here to tell us about, share our thoughts about stigma, the medical profession, and generally the helping professionals. Welcome, Dr. Shiva. Go ahead.
Thank you, Dr. Thiru, for the very good introduction, and thank you, Dr. Thomas, for giving me this opportunity. So before starting, I would like to give a real life scenario which I faced during my childhood also. Okay, so it all happens even in real life scenarios now in every school. So there were one of my batchmates who were actually into this substance at a very young age, and school administration has punished them. So probably they found it an effective way of punishment. But I would, as a psychiatrist now, would suggest that punishment is not the one which was needed to be done. So I think many schools have this kind of punishment cells, which give, punish the child for taking a substance rather than educating them, rather than creating awareness about the harmful effects of the substance. The punishments will have a huge impact on the child in the near future. And these are one of the factors which play a major role for the person to get into substance use disorder. And it will be very difficult for them to come out of it. So right from school age, it is our responsibility to educate the schools, especially teachers, and most of the schools are doing a great job. In our alumni also, there are many teachers who have done a really great job in educating, creating awareness. And stigma is the major thing that is coming into act here. And like I said, we need to have, at the root level, right from the childhood, we need to start educating everyone. And major factors that are hindering a treatment process are mainly, as our theme itself says, that stop the stigma and discrimination. Discrimination among all age groups is very widely prevalent now. And the treatment process is also hindered because of various factors like, the cost of care. Most of the people coming from the rural background, especially in our country, India, many people who are not aware of what different kinds of substances are already there and what are the different effects of the substances. Rather, they feel some kind of stigma because of the society. Society is already putting a huge pressure. The relatives, the family members are putting a huge pressure on them, that and also labeling them, saying that he's a drunkard. As Ashwin has already mentioned about different terminologies we can actually use instead of the actual terminologies. Some of them being, instead of using the terms like drug abuser, we can use the person with substance use disorder, and person who's we call sometimes they are called as drug addicts. We can use the term addiction instead, the person who's having addiction or suffering from addiction, because we need to treat addiction as a disease. not as a, a societal stigma. So that actually has a huge impact on that client, and also plays a huge role in preventing further relapses. Also, it gives confidence to the person to approach treatment. So there are various treatment methods, so we can explain to them. And one more factor is people, especially the family members, believe that substance use disorder is nothing but it will get treated on its own. You can stop the substance right away. So sometimes without help, they usually think that it can be solved. So that also plays a major role. That also is a part of stigma. And sometimes they're unaware of the services, where to go, which place to go, which hospital or which center treats people with substance use disorders. They're mostly unaware. And that also acts as a barrier, a limitation for treatment process. And one more thing is most important thing, I would say, confidentiality. So confidentiality is a major thing. They actually do not approach for treatment because of this, what their neighbor would think, what their, especially in the rural background, this is most widely prevalent. Because I see a lot of cases from rural background as well, who have a lot of stigma, and the awareness programs are very minimal, and which needs to be improvised more. And one of the speaker was rightly saying that it has a effect on the job as well. In the other countries, especially the US and the UK, from what I heard is they are actually tagged with the diagnosis also, and it will have a negative impact in their further job profiles. It's very widely being done even in the corporate sector in all the countries. So that needs to be modulated, modified. I would think of different ways so that we can maintain confidentiality in that purposes also. Yeah, and different views about that also can be entertained. And also, most importantly is there is fear of the mental health treatment is not covered by insurance policies, so they do not approach for treatment because of that kind of stigma. And media, so social media and the television news channels should portray in a positive way rather than portraying in a negative way. They usually put labels on a person. Suppose if there's an accident, if there's an accident and a person has had injuries due to alcohol intake, in a way they portrayed that the person is drunkard and he has driven the vehicle and caused accident, which needs to be portrayed in a different way. It is possible to portray in a different way, in a positive way, so that people do not stigmatize a person like that. Yeah, and self-stigma is also, all these factors play a huge role in self-stigma. And as a medical professional, as a doctor, I would also stress more upon stigma in the medical fraternity. And there are many, professionals who actually take substance even in the medical fraternity, let it be anyone, any professional. So there is stigma. They are very afraid of what the other medical fraternity would think, what is going to happen to my patients. So that is usually there. So that also needs to be cleared off in the medical fraternity. And whenever there is any comorbid mental illness like schizophrenia, bipolar disorder, and any anxiety, even if it's depression also, there is stigma. And moreover, adding on to that, substance abuse disorder, substance use disorders will also add upon that stigma. So we need to treat how we treat a physical illness like hypertension, diabetes. We need to have that we need to remove that stigma, kind of stigma for mental illnesses also, especially substance use disorders. At least mental illnesses like schizophrenia and bipolar disorder, people approach, and depression and anxiety, people approach, in case of neurotic illnesses, people approach for their illnesses for treatment. But substance use disorders, clients, they are not aware, I would say. They are very, lagging behind in terms of treatment. They are not aware. People are not aware. So they are also approaching for other treatment modalities, which are less stigmatized, like naturopathies. So, and that also can be done, but there are pros and cons for every treatment modalities. So depending on the severity of the illness, they need to decide upon the treatment. So these are the various things that as a doctor I would stress upon. And I would like to have more approaches, more ideas about what different treatment modalities are being used worldwide. So it's always a good thing to learn more and more. I would.
Okay, the researcher has spoken. Thank you for that, Doctor. I like the first point you made, that in early intervention, we need to see substance use, experimentation, drug use, and approach the youngster with understanding rather than with punitive, punishing kind of an attitude. Because when you are able to hear him out, empathize, and see the issues that are influencing his use of drugs, that opens a new way of coping for him. But instead, punishing and being punitive almost labels him and almost makes sure that he goes more heavily into drug use. I like the point you made about the media, about how language in the media really matters a great deal. The belittling language that we use can be really harmful for the person and for other people who are struggling with the same issues. I like the idea that you emphasize the need to increase the knowledge level, like all of us need to learn more, not just people in the field, but also other people, other physicians, nurses, teachers, etc., knowing more about substance use and how can they be supportive. Yeah, you threw in a lot of ideas, Dr. Shiva. Yeah, so I'm trying to wrap my head around it. Thank you for that. Would somebody else like to make a comment? One of the speakers, anybody wants to have a go? Any thoughts?
Yeah, I'd just like to add, I totally agree with what was just shared by Dr. Yella. So, a lot of people that are have been arrested, that are in prison, that are being processed, they are not necessarily bad people. They are sick people, and they are being punished. I was invited to a radio show every Sunday, and initially they gave me just 5 minutes a segment, and now it's been increased to 15-20 minutes, and the inmates are writing to me, and it's very moving to see some of these guys are serving 20 years, 10 years for various crimes, but many of them are drug related. And I feel the sentencing is so harsh, so harsh. One gentleman just got released after 10 years here in Lantau Island for a small amount of possession of drugs. So, his future is very, very limited. Does it make him a bad guy? No. Some of the listeners in the radio show are there for murder and for various other horrendous crimes. They deserve their due punishment. But when it comes to people in recovery, and I just feel there is that stigma, and it's so hard to shake it off. Singapore, various places, Singapore, Malaysia, Hong Kong, Japan, many places. If being convicted, you are in serious trouble.
Yeah. Yes. So we invite our last speaker. We have with us Father George Kannandevan. He's runs 2 addiction centers, has been working in substance use related issues for at least 3 decades now. He runs treatment centers in Karnataka, operates now from Maharashtra. He's all over the country. He is here to talk about stigma from the religious perspective as a representative of the from faith. Go ahead, sir.
Good evening, everybody, and thank you, Thiru, for that introduction. I want to begin by appreciating my good friend Thomas for this great initiative and a calling. I'm so happy to see we have 100+ people who are part of this program. So it's a great awareness program, great training program happening. I'm sure this is going to create many more people interested in the field and also professionals who will be working in this field to reach help to more people. So congratulations, dear my friend Thomas and the whole calling team. I work at a rehab center in Bangalore for people with leprosy, HIV, and disabilities. It is called Sumanahalli Society. I had sent one of my staff for a de-addiction program to my own center in Belgaum called the Hope Recovery Center. He was in very bad shape physically and in every way. He had lost his family. He came back after his 1 month's program, and he came to my office yesterday, and he just came and hugged me. I also got up, I hugged him back, and he was just not leaving me. I think he was feeling so comfortable, and he told me into my ears, "You gave back my life to me." And all our staff in the office were all looking at it. They were also very happy. And I think he was saying from his heart, "You gave my life back to me." Well, the whole fact of what we can do from a religious perspective, the fact of accepting someone who has a problem as a person and being able to look at that person as someone in need, someone who is undergoing the fact of a disease, and how when he would like to have a change in his life, are we willing to accept him, receive him, give him the kind of atmosphere to go back to his life and be a normal person? So I think this whole aspect of stigma is something that very often prevents people. Whether religion can be a factor to help people to lift up and to change, that is what we would like to see today. I was looking at the Catholic Church. I belong to the Catholic Church. I'm a Catholic priest. I was trying to look at some great people who are contributed in this field. I came across the name of Father Joe Pereira, who was one of the first addiction specialists in the country, and he started the Kripa Foundation in Mumbai. And also happy to read about his life history. He went on to establish 21 treatment centers across 10 states in the country, and thousands of people have been recovered through that program. And I was trying to look at the Catholic directory to find that there are hundreds of treatment centers run by the Catholic Church, the fathers and the sisters, across the length and breadth of the country. And I was also trying to look at the whole AM meeting settings. Where does it happen? Sure. There are about 120 AM meetings that happen in the city of Bangalore, where I live. And almost 65 of them are running in church campuses. Sure. So I was very happy to see the kind of the ways that the religion can promote and help people to recover. If you look at the scenario in Kerala, the entire prohibition movement in Kerala was actually led from the front by the leaders of the church. And the center in Kottayam called TRADA has been able to train so many professionals who are now working in various centers across the country. So in every way, when a religion is really open to support and help, well, there are so many ways in which it can be done. And I think we should look at this beautiful contribution various religions are doing towards it. My own experience of working in this field, I started a small program called Hope Anti-Addiction Action Group, which we set up among the students when I was studying. And we went for research across various states to find out what's happening regarding drug abuse. Later on, we set up the Hope Recovery Center in Belgaum in '99. And this year, incidentally, we are setting up the second center, which is going to be in Goa, which is a 40-bedded center. And our center in Belgaum is an 80-bedded center now, probably one of the biggest that we have in Karnataka. What do the religions say about substance abuse? If you look at the religious texts or the books of all the religions, all major religions discourage the use of substance. If you look at the Bible, we have numerous quotations which are telling us about what is going to happen with people who are abusing it, and therefore keep away from it. A lot of advices are given in the line of being sober and to keep away from alcohol and drugs. I'm sure all major religions are discouraging substance abuse. At the same time, we look at what religions are doing today. All religious leaders today and most of the religious establishments are showing an openness to help people who are having a problem with alcohol or drugs. So which is something that is beautiful. So the message is, you hate the sin, don't hate the sinner. You consider this as a problem, yes, but the person who is affected, he is God's child. Every one of us are God's children, and therefore you look at every person, even they may be with a problem of substance, but all are God's children, and therefore people first, the person first. That's a message that UN is giving us this year. And I think this is what all religions are trying to help in terms of accepting the person with a problem, but trying to say that substance abuse is something that is bad. What is it that we could do as religious leaders? There are various religious leaders, and there are a lot of things which they could actually do in terms of prevention, in terms of treatment, in terms of rehabilitation. First of all, understand the person who is affected. This is a disease. He's not a bad guy. Accept him, acknowledge him, and try to be with him in his moment of failure. Number two, refer him for treatment programs. There are numerous treatment programs available. If you find somebody in your community that is affected, refer them to the treatment centers around, because they may not have the information. Sometimes they may not have the money to go for a treatment program. So can we help them to go for treatment programs? Is the second thing. Number three, when people come back after treatment, acceptance by someone in the community who is a community leader is very important, because very often the family is not able to accept them or understand them. I think the religious centers have a great role in taking back this person Can you give him a small job? Can he volunteer with you? Make him part of your community activities and make him feel as someone successful and someone positive. I think this will give a great boost for people who are coming back after treatment. And can we refer them to the anonymous movement? Can we start anonymous movements in the places that we are? Everywhere that I have worked as parish priest or institutions, including my leprosy center, we have an AA meeting in the campus. So this is something which can be done by all religious leaders, making their places available for the AA meetings to happen. The church and the religious leaders can take up leadership in de-addiction programs. As I said, many of the centers are run by us, and more of such programs can be established in places where it is not available now.
Yes.
Take leadership in prevention activities. Yesterday was the International Day Against Drugs and Alcohol. I have a school in the campus, so morning time we spend time by creating awareness among our students. Afternoon, we had an awareness programs by a group that came and did a skit and awareness among the inmates that we have in our center. So I think all our establishments should spend more time on giving the information about drugs and alcohol wherever we are, because religious leaders run numerous institutions across the country, whether it is education, healthcare. And if all of us really did invest time in creating the right kind of information and treatment programs, that would go a long way. To end it, I said, when we started the de-addiction or treatment programs, we named it as Hope. And Vikas, I think, mentioned about it. What people are missing today is this element of hope. So I think we need to have more of hope centers, and all our centers, let it bring hope. And I think God would be with us when we try to spread the message of hope for everyone who is finding themselves in a difficult situation today. Thank you.
Thank you for that. Very well put, Father. The bringing in the idea that we need to present hope, because we know that treatment works. We know recovery is possible. We see fine examples every day in our treatment centers. In many ways, working in the substance use field is a blessing, isn't it? You can see that magical transformation that's happened. Sometimes you think, in 1 year, this person can do so much. How did this happen? It's marvelous to be a witness to the whole recovery process of clients who walk into our treatment centers. All the panelists here have seen, and like the magic shows, you say what happens before and what happens after. That magical transformation that happens with recovery. I thank all the panelists here for being part of this, for making your contribution, for bringing new life, new meaning, and joy into lives of so many people. I have not received any questions, so I'm just going to wind up with the highlights from all the speakers here. I think I would like to pull it together with highlighting 3 issues. One was using the people first language, instead of saying, like as Dr. Shiva and Ashwin stressed, instead of saying an alcoholic, you say a person with alcohol use disorder. Because when you see the person first, you see him as a person, you get interested in him as a person, you want to help him, rather than look at what he stands for, what the word addiction stands for. Instead of saying people is clean and sober, we say he's in recovery. When you have people who come into the field helping other people, we say people with lived experience, rather than saying recovered drug user. And as professionals, I think we also need to use language that reflects respect and empathy, which Ashwin stressed, emphasized, recognize that wellness is possible and it is ongoing. I think being able to show respect and empathy is one of the biggest things that we can contribute to the field. Second aspect is, I think Shiva said that we all need to speak up. speak up with our own team, speak to the media, speak to the community people. Father talked about getting active in the field of awareness building and prevention. Grant talked about talking to the media. Being able to help people recognize. I think Vikas was a huge meeting yesterday in Jammu and Kashmir. So I think it's Shiva repeatedly said we need to go out and talk more. So let's help people understand that addiction is a brain disease. It needs to be seen with the same view like diabetes and hypertension, and knowing that treatment does make change possible, and address it as a brain disorder rather than as if the person has something missing, as somebody who's not trustworthy. The second thing I want to emphasize, that all of us go and speak about this. The third one is, of course, to provide hope. I think fathers brought that message in very clearly, but that was what Vikas was also saying. That was what Grant was saying, to be able to present that message of hope. So I'd invite all of us to look at ourselves, examine the language you use, provide hope, give messages of hope and inspire, share our inspiring stories, share stories of recovery. And thirdly is to be brave and speak up with our own team, our family members, our friends, our communities, to show that treatment is possible. Addiction is a disease, and stigma has no place in making this magical transformation. Does anybody else want to say something? Thomas or any of the panel speakers, if you want to say something, we can say, and then we can close.
So since we have 2 questions in the chat box, I would like to encourage some more questions and have you actively participated by posting your questions in the chat box. So if there is more questions, or do you have to say something, I would like you to engage directly with the esteemed panelists and gain a deeper insight in the topic. So don't hesitate to ask question and use your chat box. We have 2 questions to you, madam.
Yeah, I saw Raman's question about shame, and then what it's cannot be cured. Yeah, Shekhar Bardhan is just making a statement that it's a disease. Yeah, we have yes, towards the profession as well. Yes, okay, Maheen has raised issue. Let's take Raman's questions. Raman's question is about what is really shame. I think shame and guilt is often seen together. Guilt is something which I can take responsibility for and say, okay, I made a mistake, Raman, I was rude to you, and I'm sorry about it. That I can do something to handle that guilt. I can address it. But with shame, it becomes all-encompassing. When there is shame, I reject myself as a person. That is why that's what stigma does. Stigma belittles me, makes me feel I'm worthless. It portrays me as a person who's negligent, who cannot be trusted, who's very dangerous, who can amount to nothing good, etc. So when stigma with addiction tells all these messages to a person with substance use problems, it tells a family that one of your family members is so worthless and dangerous and unworthy. So that is why shame needs to be broken. Stigma needs to be broken. So we see them as human beings in all their glory, and recognize it is just an addiction like diabetes or hypertension, and that it can be treated. Would any of the panelists would like to comment on Mr. Raman's comment about shame, please?
Yeah.
Anybody?
I'd
Go
like
ahead.
to add one line, ma'am.
Go ahead.
Is something that when I am not accepting about something that I've done, because it doesn't resonate with the image that I have about myself, but I have done that thing, it also puts me in shame. Rather than not accepting it, I need to accept that, yes, I've done it. So that breaks the barrier of moving out of shame. And with the hope within myself that I will not repeat that again.
Yes. Yeah. Right. Not being able to handle it sometimes makes us uncomfortable. We have Kaisar has raised an interesting question. I'm reading the question for the benefit of the panelists here. As a substance use professional or as a person who works in this field, do you think there is stigma towards the profession as well?
I would say every day.
Experience, yeah.
I would say
Anything
every day.
every
As a
day.
psychiatrist,
Tell us, tell them. Yes, go ahead.
yeah, as a psychiatrist, many clients of mine usually have this stigma towards approaching a psychiatrist. So they do not go to a psychiatrist, but they go to a neurologist or a physician for the same illness. For schizophrenia, bipolar disorder, substance use, they go to a neurologist and or a physician. So I face this kind of stigma every day in my practice. But still, I have a good support from my fellow doctors, from other subspecialties who actually, refer to me, the clients, explain to them that it's not something to be treated by a non-psychiatrist. So they have this good rapport, and they usually refer to me. They make it a, a sense of feeling that it needs to be treated by a mental health professional by themselves.
Okay, you made the comparison with the neurologist. Let's look at a social scene. Let's take a wedding reception. Okay, the psychiatrist is there, the cardiologist is there, diabetologist is there. Your client, he will recognize his diabetologist, he will recognize his cardiac surgeon, but he is not going to make doesn't want to acknowledge the psychiatrist or addiction counselor or counselor, for example. I mean, just because you work in the field of addiction, there is some kind of stigma that pushes onto you, isn't it? I don't want to have anything to do. If I say Shiva, they may say, oh, you have a mental problem or do you have an addiction problem? I think so. Yes, Father, I saw your hand up. Just a minute, Father. I think we've seen that. Ashwin, you must have noticed it, Grant. Yes?
Yeah.
I don't know, as an early woman in the field, people say, addiction, you're working, you're going to the village, you're in a room with 25 guys. Are you sure you're okay? Of course I'm okay. But Mahir, that question was well put. Working in the field, sometimes to the profession also, people look at you like you couldn't find any other good field. You're not capable of working another. I thought we were smarter and the blessed ones to work in this field. Yes, Ashwin and then Father. Anybody else wants to make a comment? Yes, Shiva, Dr. Shiva.
Yeah. Regarding the stigma, it's always there. We need to work towards different approaches to reduce it. And one more question is there, that why addiction is a disease. So it's a chronic relapsing disease. It involves many factors, genetic factors, and the neurotransmitter imbalance.
Genetics, the environment, the personal qualities, the trauma, the abuse that could have happened.
Psychosocial factors.
Poverty, yeah.
Yeah, so it involves many factors. There are many etiological factors that are responsible. Just like how diabetes is caused due to sedentary lifestyle, due to genetics, due to other factors. And
many of the factors are not within his control.
Yes, it is not within his control. So similarly, addiction is a similar kind of disease. It needs to be treated as a disease rather than just a condition.
Yes. Whenever I use drugs, my blood is pumped with dopamine. The reward center is hijacked. So once my brain has been repeatedly exposed to it, and there is a shift in the way the chemicals work in my brain, even if I don't want to, I'm not able to stay off drugs. It's clearly a brain disorder over which I have no control. So getting the drugs out of my system, revamping my lifestyle, getting support of people around me is so cardinal to recovery. But the important thing is recovery can and will happen. Yes, Father, I wanted to say something, Father.
I would like to say that working in the field of recovery is a great blessing.
Yes.
It's a great blessing. I think we are doing something which most other people cannot do. We are doing something much more than a doctor can do. A doctor is only treating a physical condition, whereas we are treating something that is affecting their spirituality, affecting their family, affecting their social life, affecting their economy, affecting their life views. Everything is something that is being taken care of by an addiction specialist. And therefore, I think it's an amazing job, a great job. We should all feel proud of being an addiction worker. So I don't think it's something that is stigmatizing. I think it's a great blessing, and we are very proud to be an addiction worker.
Yes. Well said,
Yeah.
Father. Well said.
I
Yes.
totally agree. I have a client who recently said to me, "You changed the trajectory of my life. You gave me my life back. You gave me my marriage back, but I could never do what you do. You work with liars. Your business, everything is based on unreliable people, and I was one of them. I don't know how you can do it, but it takes a certain individual to do it. But if I may very quickly, mention a few things that I have found to be quite useful when it comes to self-stigma, working with clients, the empty chair, Gestalt therapy. If it's the boss, put the boss in the chair and talk to the boss. Offload, whether it's about age or mental health. So, process groups, if it's a treatment facility, acceptance commitment therapy, especially when it comes to values and goals, working with clients with that's very effective. And then you got CBT, automatic thoughts, negative thoughts that come up, and how to process that. It's I had the great privilege of learning a lot from you, Dr. Tirumam, and I remember a lot of the stuff that we learned, and through applying that, I have found it to be extremely useful. So there are acceptance commitment therapy, cognitive behavioral therapy, 12-step facilitation therapy. It all has its role, and there are a lot of wonderful techniques. But the empty chair is quite powerful. Yeah.
Thank you for that. So I think that's a good point in which we can end. Recognize, I think in our audience, we have many people who are wondering whether they want to work in this field. Some of them are 2 steps in, wondering whether they want to continue to work in the field. I think it's a time we close with this note of celebration that we are doing very meaningful work. But the returns are also very high, isn't it? As a professional, you get to see a beautiful recovery happening. We are seeing people reestablish their health, wellness, and in terms of increasing their working up to their potential in their lives. So I invite everybody to join this group. Send messages of prevention, as Father and as Dr. Shiva said. Continue to work with them with all the skills that you can, that Ashwin and Grant emphasized. And also remember that to celebrate each and every recovery, because as Vikas beautifully portrayed, recovery can be very challenging for the person, and to be there when he does the whole beautiful journey through. So thank you all for coming. And let's hope we go out and make a difference in this world. Thank you, all of you, especially to each of the speakers. Well done. Thank you.
Thank you, Dr. Thiru.
So,
Thomas?
hello everyone. I would like to say a little bit thank you for coming. So, thank you all for joining us today for this Zoom discussion on People First to stop stigma and discrimination. Your presence and active engagement have made this event truly meaningful. I would like to extend a special thanks to our moderator, Dr. Tirumagul V, for guiding the discussion and ensuring a fruitful exchange of ideas. Your expertise as the UTC training consultant for Ecolink and leadership have greatly contributed to the success of this panel discussion. I want to express my heartfelt appreciation to our esteemed panelists, Ashwin Thind, Grant Sanders, Dr. Siva, Vikas Sharma, and Dr. George Kanandan. Your insight and expertise have shed light on various aspects of stigma and discrimination. Furthermore, I want to acknowledge the Ecolink Institute of Wellbeing and its alumni group worldwide for their support in organizing this event. Your commitment to promoting well-being in the field of SUD and addressing the social stigma is commendable. Lastly, I want to thank all the participants for actively engaging in this discussion, sharing your thoughts, asking questions, and contributing to dynamic dialogue. Your participation has reinforced our shared commitment towards this cause. So let us carry forward the insight that we learned, that we gained from this panel discussion, and translate them into action. One last thing I want to mention is we have shared information on our upcoming course, Science of Addiction, in the chat box. So this course will delve deep into the understanding addiction and its effects. So don't miss out on this opportunity to expand your knowledge in the field. You can either go to the link and apply for the short course or contact us by email or WhatsApp. Once again, I extend my deepest appreciation to everyone involved in making this panel discussion a success. Your commitment and passion for addressing the stigma and discrimination are truly commendable. So thank you.
Thank you, Ronnie.
Thank you. Thank you, Ronnie.
Everybody.
Bye-bye.
Thank you all.
Bye.
Thank you
Thanks,
all.
Ronnie.
Bye-bye.
Thank you. All of you.
Mm.
Bye-bye.
Bye-bye.
And bye-bye.
Thank you so much. Bye.
Hi, Tiara.
Thank you.
Thank you, madam.
Bye, ma'am. Thank you very much. See you.
Thank you, ma'am.
See you too. Bye-bye. Bye, Kauma.
Thank you. Thank you, ma'am.
Thank you.
Yes,
Nice to
yes.
see you.
Thank you, Thiruma.
Bye, Isha.
Thanks, ma'am. Very informative. Thanks.
Mr. Bhagat, we'll discuss this with